Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
Or we'd like to think we are. No, actually, that's our opinion.
In our opinion, yeah. And today, we've got our, remember that, Stan and Ollie? I'm sorry, Ollie. We got our Garcia ties on, yeah.
I always think of the Grateful Dead with Garcia, you know.
Oh, that's what it was.
Well,
I'm saying this action was.
Can we get on with
All
this,
right.
Bob?
You're running the show here. I don't even know what we're talking about today.
Well, I want to talk about physical therapy, and here we got a case history. In other words, this is a patient I worked with recently. It's a really good educational tool to find out what physical therapists can really do to help you out. What we have is back and neck pain. I got the document here. Obviously, I'm not going to mention anybody's name here or where it was done for confidentiality reasons, but I had
You already said your name. You said you're Brad Heineck.
patient.
Oh, okay.
Let's get serious here, Bob. We have a 76-year-old female retired teacher. And here is what I got from the doctor. This is real interesting, I find. The person is diagnosed with sciatica, left buttock pain to the posterior thigh, in other words, running down her leg. Also, trapezius pain up in the shoulder, and it goes down into her arm as well. Difficulties turning her head to the left. Onset 2 weeks ago. This person also has been working with this, trying to get it better. She's already tried massage therapist. She's been to a chiropractor. She goes to the massage therapist weekly. She's a very active person for her age. She's retired, but a lot of community service.
Sure.
Very active, talks a lot, a real pleasant person. So this is really bothering her on a daily basis. Her work includes transporting children, daycare, to preschool, etc. So
She's really, if I can jump in here,
Sure.
she's really got two separate areas of pain.
Yeah, she does.
I mean,
Exactly.
two separate problems.
Yeah.
Okay.
When I saw this, I thought, oh my gosh, as a therapist,
This is a lot.
Yeah, you're
this
looking at
is-
that. And,
Because it's enough to deal with one area, but to deal with two is very difficult.
She's already seen the chiropractor,
Yeah,
the
she's already
massage
been through a lot.
therapist. She's an intelligent person. She's motivated. I thought, oh, this is going to be I'm thinking, oh, I'm going to have to scratch my head on this. If you want to zoom in on this, right here, Nancy, this is how she described it. She actually drew this on here. So she had pain on the left side, neck, shoulder, down over the shoulder, and then on the left side, on the back side of the left buttock, and down into the leg here. And those were the problems, or giving her problems, and just raising havoc in her life. So I did the evaluation. I'm not going to get too detailed about that, but after I got done, it was still a little bit puzzling to me. How am I going to treat this, get both at the same time? As a McKenzie therapist, being McKenzie trained, Robin McKenzie, we have a video on this as well, and I do endorse the self-treatment books. And I think this person probably could have treated herself if she had the How to Treat Your Back book and How to Treat Your Neck book, because I had her do 2 exercises. I saw her on a Tuesday. I had her go home, both exercises, lumbar extension and cervical extension. I'm not going to get into that detail right now. She came back in 2 days, and if you look here, zoom in on this again. Right here, are you on that, Nancy? Absolutely nothing shaded in on her neck and her shoulder. Pain was 100% gone. And then down in her hip, 75% of the pain was gone in her hip. She says, I don't even know if I needed to come in today. We talked about it a little bit. She's going to continue to do the exercise that she did. It's simply cervical extension, laying on her stomach, lumbar extension, 10 repetitions. She started out at 5 times per day, and she cut down to once per day for maintenance. 2 visits, problem gone. I tell you, when you're a therapist, something like this happens.
Stuff that really
it really, I think, man, I'm good.
The title of the book is How to Treat Your Own Back.
Right, yeah.
By Robin McKenzie.
Right.
Maybe we can have Nancy put the name on
Sure.
there. We can spell it out for her. And How to Treat Your Own Neck.
Yep.
Did I say that already? Neck. How to Treat Your Own Back. How to Treat Your Own Neck.
Right.
And I've gone to a lot of courses too, and McKenzie and other. And what we're always told a lot of times, if you understand these courses, and as a therapist, if you practice these ways, you're gonna and you see a lot of patients, you're gonna see a miracle a day, and
Sure.
that's really a miracle. When a person has been going through all these things, seeing all these people, and they didn't get any better, and they see Brad one time, and they come back and have gotten that much better, you know, that's a slight miracle, and we see that quite often.
Yeah,
I mean,
it's fun.
yeah, it's really fun, because we get a lot of them that don't get better that
Right,
quick,
this,
so.
yeah, if anybody's honest with you in this practice, you know, you get these that happen more, you know, that happen, and the other times, most of the time you do well. There's a few where you just have difficulties, but
Well,
this is,
one of the other
fun.
lessons to be learned is that just because you didn't have success with a chiropractor or with your doctor or with a massage, doesn't mean that you can't have success.
Right.
I mean, sometimes it's just getting the right eyes to look at it and the right person
Sure.
to prescribe the right things.
There is one thing we have a hard time, we really haven't dealt with it. What is that, Bob?
Well, we can fix just about anything, but we can't fix
A broken
a
heart.
broken heart.
But we might get into it someday.
Yeah,